Good evening, everyone, and thank you for joining us and for some great education from Assisi Animal Health. And this evening's subject is noise phobia, bang, pop, hand-wringing, and sweaty paws. Our presenter this evening is Dr. Jeff Nichol, DVM, IAABC. Dr. Nichol did his undergraduate studies and graduated from veterinary school at Michigan State University. He has been a veterinarian hospital owner and practiced general and behavior medicine throughout his career. In 2015, Dr. Nichol completed his residency in behavior medicine through the American College of Veterinary Behaviorists. His current practices, located in Albuquerque and Santa Fe, New Mexico, are limited to the diagnosis and treatment of behavior disorders of pets. Medical comorbidities are a common feature in his caseload. We welcome Dr. Nichol.
Thank you, Carolyn, and I'm so glad we have a good lot of dedicated practitioners. You know, the problem with behavior medicine in a regular general practice is that the pet parents are often asking the question in that last 20 seconds of the exam, and they want a simple answer. And if you are here, that means you understand that there are not simple answers, although there are some things that can make this thing much easier. So what I'm going to do today is talk about what dogs are afflicted with this kind of problem, these noise phobias. Interestingly, there are some dogs who are going to be phobic of fireworks, but not necessarily thunderstorms, but commonly it's across the board, gunshots included. But you know, some of these things are going to be certain types of breeds and certain ages can be afflicted as well. We'll talk also about the kinds of questions you want to ask to gather the most thorough history, because there are comorbidities, behavioral as well as physical sometimes, that are a part of these things. And we want to know every behavioral problem that's going on with these pets. And commonly, these noise phobias are involved with other anxiety-driven behaviors. And if we can identify them all, then we can sometimes use the same kinds of treatments to improve this dog in other ways, not just its phobia of things like fireworks. But then I'm also going to explain to you what the pet parent can do, because they want to do something. They love their pets and they don't like seeing them just pacing and agitated or crawling up in a ball and trembling. So we need to help them too, because they're actually our client. And we'll learn all that stuff in about 50 minutes. And then if you want to stick around, we'll have time for questions. So we've got a problem. Here's the definition of phobia. And it's out of proportion to the threat. Now, you know, how many of the pets we see have actually been hit by a bottle rocket? They have not. But I can tell you from my own experience, and I have a picture of my excellent Border Collie here coming up, that she had no problem at all with storm phobia, for example, until we were hiking on the irrigation ditch near our house in the valley, the Rio Grande Valley, north of Albuquerque, where we live. And I typically don't have any trouble with storm phobia either. But there was this clap of thunder that struck very close to us, and I jumped. And I think I cried out a little bit, and she was just trotting along ahead of me, and she stopped in her tracks and turned around and looked at me. And I did my best to say, look, we're good, let's keep going. But since that time, thunderstorms have been a problem for her. And I treat them very, very carefully, because if we don't manage them early, then repetition tends to worsen the problem. We'll talk a little bit more about that. But as you can see from this slide, that noise reactivity, at the very least, afflicts roughly half of the pet dogs out there. And there are gray zones, of course, everywhere from, at one end, dogs who have no trouble at all with this kind of stuff, to dogs who are actually getting diarrhea and soiling and becoming self-mutilating and doing just extreme behaviors because of the intensity of their phobias. So we've got the whole range in here, but we do know that dogs who are noise reactive or noise sensitive, if there is enough repetition, they can very ultimately become noise phobic, and that's kind of the extreme end. And the information I'm giving you, by the way, like any other good thing in veterinary medicine, is all research-based, and I have a few references that I've listed on these slides. So genetics, there's been a lot of robust research recently on the genetics of behavior, and it's a real hot topic for us, and so we're going to be seeing a great deal more of it. But herding breeds are particularly affected. And of course, there's my herding dog, my border collie, Miss America, is sitting there, not during fireworks or a storm because she looks rather sanguine there, and she typically is. But age can be a factor as well. And you say, well, if it's more common in adolescent dogs, does that mean that some of them can outgrow it? Maybe. We really don't know that, but every single one of these should be treated. And it's a good idea to ask your clients whether you're going into storm season or we've got July 4th right around the corner. We want to find out from our clients, are you having a problem with this? And it's not a bad question. If you have a questionnaire that you ask your clients to complete while they're waiting, which I guess everybody's doing in their car outside the building now, does your dog seem to have a problem with fireworks and other loud noises? Because they may not tell you, and they might say, oh, we're doing the best we can with it. You'd be impressed the number of pet parents who have no idea that veterinarians can be skilled and equipped at handling behavior disorders, and frankly, much, much better than some of the other self-proclaimed experts out there. And we need to, help our clients. So they want us to, and of course, they want things as simple as possible. We Americans are not known for our patience. We want it solved 10 minutes ago. Well, they want something to help the dog feel better, but they want something that they can do hands-on for their pet. They don't simply want to give a medication and say, okay, you're on your own. They want to do something because they love their pets. And so we'll talk about that as well, because as we all know, unless you just started this line of work yesterday, you've already figured out that we need to take care of the client as well as the pet. So there's very clear pathophysiology understood on these things. And when it comes to something that's panic related, there is an immediate release of epinephrine, adrenaline, but also other excitatory neurotransmitters like glutamate, for example. And these things literally flood the prefrontal thinking part of the brain, the prefrontal cortex. And it is physiologically not possible for anybody, I don't care what species, to think and make a clear decision about whether something is a legitimate threat. And so as long as those excitatory neurotransmitters are being released, and as long as it may take for the body to reabsorb those in the brain, and it can take a long time depending if these blasts and explosions in the air just keep continuing, then these pets can be frantic and simply not themselves. So, you can look at the list of symptoms. I'm sure probably everybody is familiar with a lot of those things, but escape behaviors can be a very big part of it, and that can be very distressing to the client. And as much as many of these pets, like that little Pomeranian or in that photograph, can be hypervigilant, this dog is showing real fear signaling. It's got what we call the whale eye, that you can see that crescent moon shape of the sclera, and the dog is looking at something that's scaring it, but it's trying to move its head away because it sort of doesn't want to. It's a conflicting state of emotion. And dogs can become fearful of their people who they trust and love when there are such enormous fear motivators going on, like exploding fireworks. And people, they want to hold the pet, particularly small dogs, and they have to be aware that sometimes when these pets get highly agitated and severely afraid, that they can become defensive aggressive, behave in ways that they never would any other time, and that can be really distressing for people. Like, what should I do if I can't handle the pet? We'll get there in a minute, okay? But we do have to treat them as individuals. They're not all the same. And it necessitates spending some time with people. And I'll talk a little bit more about that in a minute, how we can really provide the service that these people need, because it takes a little bit of time and you shouldn't give it away. So multisystemic involvement. Their dogs are tachycardic, they're tachypneic, they're panting, but also many of them won't eat. And, around here and in New Mexico, I think we've got a major pyromania problem around here, and the fireworks will go on for 3 to 4 days, usually 4. And these pets need to eat, and they'll have stress diarrhea. These people need continuing help with these pets. The hypothalamic pituitary axis gets triggered on these things. And of course, you get cortisol and glucocorticoid releases. And if this goes on for a long time, it can start having internal consequences, not just on the brain. But speaking of the brain, if there is continued frequent fear triggers, maybe beyond just noise phobia events like fireworks, but there are dogs who become so highly agitated in response to so many triggers that they will start to develop a deficiency in the brain-derived neurotrophic factor, which is very recent research has shown that it actually causes shrinkage of the hippocampus, which is largely associated with long-term memory, but other factors as well. And in fact, is that kind of fear stimulation that many dogs and many people are subjected to. It's really pretty tough on the well-being. Actually has been shown to raise the risk of dementia with aging. So we got a big responsibility in dealing with this kind of stuff. And so that's why you're here, right? So we start with the history. You know, what else is going on? People will tell you about the noise phobia issues, but what else causes their dog to be anxious? And, you know, easy questions to ask are, what about just household noises, the microwave beeping, or you know, people walking around upstairs and the floorboards are creaking a tiny bit, the phone ringing, is dog jumping with those things? Many dogs who have severe noise phobia, like to thunderstorms and fireworks, do not react to small household noises, and some do. So I can't tell you which dogs are going to do it, but it's a very important question to ask because you want to help people every way you can. So individual responses, we need to know, and people can describe this stuff, but if they're going to come in for a behavior consultation, 30 to 60 minutes, I would ask your folks at the desk to tell them to shoot some video at home when these pets are beset and besieged by this. Now, if you have dogs who only freak out during July 4th, you know, we don't wait until after they've freaked out and then come in on the 5th or the 6th. So this isn't always practical. But I'll tell you, you know, in the last number of years since everybody carries a smartphone and we all have video capability, a lot of things in life change, haven't they? And our ability to understand what's going on at home, particularly in behavior medicine, it's been a huge difference. So encourage people to show you some videos. Oftentimes they'll just bring them in, show you the smartphone. This is a dog that belonged to someone who became a friend of mine. You can, I mean, this is the kind of, he shot this at home. I wasn't there. He was at home. And here's Coda. And Coda, let's see what we do here. Just licking and trembling. I mean, this breaks your heart. And you can see that this dog, this golden retriever, is right up between his owner's knees. This big dog, probably 75 pounds, couldn't get close enough to his person. And this is a very kind family that owns this dog, and they want to do everything they can to help the dog. And they fashioned, actually, they didn't know about thunder shirts. Those appear to have some value in some cases. They're not the end all and be all. But he had two daughters, and one of them had outgrown her one-piece bathing suit as a child. So he just modified it and put it on the dog. And he felt that that helped somewhat, but obviously not enough. So let's find out what else is going on and try to help the whole creature. You know, for example, if we see a dog come in for chronic diarrhea in the exam room and we do a thorough exam and we find what's probably an unrelated problem like severe dental disease, well, we need to mention that to the client and prioritize our different issues, our different diagnoses, and you know, get it all taken care of at some point. And the same is true with behaviors. We need to understand what else is going on. So dogs who are generally fearful, for example, if you have a client who says, look, this dog is afraid of a variety of things, and fear can be manifest with aggression sometimes, aggression towards visitors, aggression on leash walks, aggression towards family, aggression between family dogs, the most common behavior problem we see in a referral behavior practice. Many of these dogs are driven by anxiety, in fact, most. And many of those fearful dogs are also noise phobic. And many of them have separation anxiety because these are all anxiety driven. And so we often find that when we have an anxiety problem, it can have a list of diagnoses, even though they're all essentially related to the primary underlying cause. So, 36 to 40% of the dogs we see with separation anxiety also have noise phobias. And separation anxiety, I mean, we all have some understanding of that. It's a severe problem. And so if you treat that and your clients are telling you about that, you really need to ask them, does this dog react to storms, fireworks, that kind of stuff? Because we need to treat it all. And if we only improve the one thing that they bring to us, we only get a modicum of improvement. But on the other hand, if we get our arms around everything that's going on, then we see a much greater improvement in all of it. And we've improved the dog's life and its people too, needless to say. So, I mean, this is just a graphic to give you some sense of how many things are involved in all this, or can be. I shouldn't say are. But you look at the bottom three things, strangers, travel. Very often dogs who are freaked out in the car, you ask them about separation behaviors. They may have that. They may not necessarily have noise phobias, but then there's generalized anxiety. This says general. The real behavioral term is generalized because that's a verb, which means that when they're younger, they are anxious in one or more particular contexts. But over time, if the anxiety is not controlled, then it generalizes. In other words, there's a growing list of arousal and anxiety triggers and a growing list of diagnoses, behavioral anxiety-related diagnoses. So if you're starting to get the idea that we want to identify this stuff early and every bit of it so we can get our arms around it just before it gets even worse, that's the takeaway on this thing. So we need to ask questions. So yeah, the brain is affected by a whole lot of other organ systems in various ways. And pain-related behaviors, for example, dogs who had been very sweet pets, and as they get older, they develop degenerative joint disease, painful difficulty standing. They can develop anticipatory aggression, some other pet in the home or a child plowing into them. Well, they learn quickly that when that other creature comes near, they might feel pain, so they react. So you look at different issues that are going on in the body. GI pain is something that I find commonly in my behavior cases. It doesn't mean it's the only cause of their reactive behaviors, but if I only treat the anxiety side of it, for example, and I leave out the skin itching on some of these atopic dogs, the dental pain, the joint pain, that kind of thing, I'm really not helping the pet that much. So what I need to do is identify every bit of this. So, you look at chronic or intermittent GI disease. Is that primary GI disease? It sure could be, but could it be stress related? Yeah, that could happen. And frankly, we see both in the same pet sometimes. So, which is it, a chicken and egg thing? It sort of doesn't matter because we're going to treat every bit of it. But we find very often that when we reduce or improve significantly the behavioral side of these things, very often the other physical problems, and I don't say physical versus behavioral because the behavioral comes from the brain, and this is very much a physical organ. It's considered the most complex in the body. Well, so if we just treat one or the other, we treat both, and sometimes when we see a significant improvement in the symptoms in various different parts of the body, maybe we can back down if we're using behavior medications, anti-anxiety medications, for example. Sometimes we can back down on that stuff and things, we don't need them. So, we start out by identifying everything, trying to manage everything, and then over time, we have to fine tune what we're doing, which, it's a hands-on thing. But we've got a lot of clients who will work with us and continue to adjust what we're doing for their individual pet, get a better long-term result that way. So, dedicated behavior consultations. So often veterinarians, I mean, we're too nice sometimes, and I don't mean that in a derogatory way because I've been this way throughout my career. There's this tendency to say, well, you came in for this problem. And here's this other thing, and I'll advise you. And so you end up on the phone a lot or answering a lot of emails. What I've learned from experience, and I've been in practice since 1975, and so I've learned a few things along the way. And one of those is that people value a service in direct proportion to how much they had to sacrifice to get it. And what that means is that if they just got a bunch of free advice, they might say, well, thank you, doctor. And they go home and they sort of cherry pick it, and I'll try this or that and see how it goes. And then they go to Dr. Google and they learn stuff from people who are very well-meaning but have no real training or understanding of whether it's behavior or internal medicine. You know, we see people giving pets supplements and all kinds of stuff that make no sense. They need to believe us. We're the ones who have the training and the access to the research and a fundamental understanding of physiology. We need to be the source of the guidance that they get. And when we charge people for this, those who pay us a fee, they're interested. And so I wouldn't in any way get involved in advising a client on a storm or fireworks phobia in anything less than a 30-minute consultation. And I would at least do an hour, actually, because you want time to get a good history, do a thorough exam, possibly a neurologic exam. I mean, the brain is neurology, and we find neurologic problems pretty commonly in our behavior cases, things that don't have overt symptoms until you get really down to the nuts and bolts of a good neuro exam. Everybody should get a full chemistry and CBC, and a thyroid screen isn't a bad idea either, especially a golden retriever, for example. And we're going to start finding those other comorbidities, and our clients are very happy that we did a thorough job. So, you know, look for these other things and charge people for your time. Whatever, you know, if an exam is 20 minutes at your hospital, then charge triple for that for an hour. You absolutely must, because you will get better results in your cases. And you know, don't, otherwise you're cutting corners, in part because the client's cutting corners. So we insist that they take it seriously, or they can follow Dr. Google. They can go to my website, for crying out loud. I've got a ton of great information I've been loading in there since the early 90s. And I've had to update some of it. But my website is drjeffnichol.com. And your clients are welcome to go there and search it, and they'll get information. And it's the genuine article. So avoidance, that's the best place to begin. You know, the old joke about going to the physician and you say, doctor, it hurts when I do this. And the doctor says, well, then don't do this. Well, here's the thing. This is a fear-driven behavior. And when we've got all those excitatory neurotransmitters making the dog's ability to function next to impossible, we really, you want to teach this dog to be calmer. You want to help reduce this dog's angst, but we've absolutely got to set the dog up for success any way we can. And so diminishing the sensory input is really what we're going to be able to do to make a difference. So mutt muffs, you'll see the Sheltie up here in the upper right corner. These things look a lot like, you know, the earmuffs somebody would wear in the wintertime, or the headset that somebody might wear in as a pilot, or the headset I'm wearing now. Well, this is a very well-designed product, and it is well tolerated by dogs. It's got a strap that goes beneath the dog's chin to help hold it in place. They come in different sizes, and people have been very pleased with how much better their dog feels just by a significant reduction in the volume of the noise coming into the poor dog's ears. Okay, light flashes, you know, thunder, you know, that's just a non-starter for these things. So, you know, close the window blinds. This little thunder cap that you see down below, it used to be called a calming cap, but the people who make thunder shirts bought the product. I have nothing against thunder shirts. It's just that many people are disappointed, and some of them say, yeah, it helps somewhat. Now, this product's pretty good because it diminishes the amount that the dog can see. We always hold a treat and invite the dog to come to this thunder cap. It's got these little gathers around the muzzle, and the dog chooses to put his face in it to get the treat, and the client can teach the pet with multiple very brief teaching sessions that the dog says, why wouldn't I put my face in this? I get this tasty little tidbit. The tendency for people is to just rush up to the dog and shove this on their face, and the dog especially If it's already starting to get frightened of fireworks, for example, it's already freaking out. So this is the kind of thing the dog needs to learn how to use by its own choice, to put its face in there to get that treat. And it needs to do that before fireworks. Well, of course, we don't have much time left, but sometimes when you have a client who's really wringing their hands, and you can explain, look, let's get you started with some treatments right now, because that's when you need help, but we need to schedule a consultation in the next week or two and put the long term into motion that's really going to make a difference next time. And this, again, this might be even more valuable for dogs with storm phobia, because we usually have more events of that than we do fireworks. So I'm going to encourage you to maybe take this as a two-step thing. Again, all very individual. But in terms of the noise, you know, these old-fashioned box-type fans, not the tower kind that are very silent and do a nice job and only take up a square foot of space in the room, but the old-fashioned big clunky things that vibrate, that sort of thing really helps. Now, some dogs do better with that by kind of drowning out the noise, but others do better with something like a white noise. You can get a white noise machine, but you can download that stuff from the internet. And there are some dogs where that cancels it out in their brain. There are others that do well with something called Through a Dog's Ear, and that's their website, throughadogs'ear.com. And they also have Through a Cat's Ear. And this is music that has been scientifically developed to synchronize with the normal brain wave rhythms in the dog or the cat. And in fact, they promote alpha waves, which are calming brain waves. And it's actually very pleasant music. We've had it at our house, and it helps our dog calm down. And it's like a classical music. It's very pleasant. And for some dogs, it makes a difference. And some of these things are going to be trial and error. And so, you know, again, you may want to have the client implement some of this stuff starting now, but continue to work with it and see what works for their pet so that we can individualize our treatment and get the best result for their own pet. Now, many people are using crates these days. It's a big thing, not a bad thing. Dogs are denning creatures by their nature, but they don't live in a den, and they have choices. The way they're genetically programmed to function, as much as they're domestic pets, and they certainly belong with us, living in our homes, but they're really driven by innate survival behaviors. And in the wild, feral dogs even today, you know, they've got a snug little place that's their own, and nobody closes and latches the door. They always have the choice to exit or go back. And that is especially important when we have a fear trigger like fireworks. So people use a crate, that door needs to stay open. In fact, unless it's a puppy and you're starting to house train it, for example, we shouldn't be trapping these pets in crates. And I know that's a harsh word, but they can panic and freak out. And, you know, separation anxiety cases, these dogs who are doing $1,500 worth of damage to the door frame every day, and their frantic attempts to escape the house or tearing the leather sofa apart, people will crate them to prevent damage to their home. And you get a lot of advice about that on the internet. And these pets will freak out. And of course, we know that they fracture their canine teeth, they cut their lips, they break their nails. And if you look at videos of dogs doing this, it's just cruel and unusual. We have no business subjecting a dog to that. And so we should never close the crate. There are other ways of dealing with separation anxiety. But if people use a wire crate that the dog is free to exit and enter on its own, it needs to have a den-like feel for the dog. So it needs to be covered. So, you know, a sheet or a towel, no heavy blanket, or they'll start to sweat in there. The top and the sides need to be covered. The front of it can remain open, or if that's covered, maybe to a few inches above the floor level, so they can see out of it, and it's a den-like structure, and they can feel good about it if they choose to use it. You know, people tend to forget that all of us want choices, and our dogs, you know, they don't get to choose where they live, who they live with, and they don't get to choose when they leave and return, because we live in a house with walls and we have windows that they don't understand and fences. So any choices that we can give back to our pet dogs is to their well-being. And so we're not forcing things on them. And there are lots of ways of working with that, and it improves their welfare. So, pet parents, what should they be doing? Well, explain, what empathy is. It's walking a mile in the other creature's moccasins. In other words, recognize that their dog is not a little person in a furry suit. It doesn't necessarily follow the same rules of behavior. Sometimes some things about dog behavior and human behavior are very similar, and some things are quite different. So they need to get an understanding of those differences, such as we're not going to trap the dog on a crate. But dogs, here's an important difference, is that dogs, they only have a couple of entitlements. They can have food, I'm sorry, start again. They can have water to drink and air to breathe without asking, Mother, may I? Everything else is a privilege that they look to their leader for approval. They earn every resource from their leader, and that's how a leader of a canine social group in the wild manages the group to ensure the best possible survival. Well, our dogs look to us that way. And so if a dog is anxious and it's getting a whole lot of comforting and petting and soothing, the pet parent feels good about that. But the dog actually believes that it has earned those interactions and it can fan the flames of the anxiety. And so what we really want people to do is to be kind enough to the dog to recognize, or empathic, to recognize that they're different and they cannot get anything that they don't earn. Or if we respond to it, we will see more of it. And that's what it means when we say what gets rewarded gets repeated. So, here's what they should not do. And, most of our pet parents aren't going to make this mistake, but sometimes there's someone in the family who does. Ridicule the dog, yell at the dog, even hit the dog for being weak or being, timid. And it makes no sense, but that does happen. And so I bring it up to people. I say, look, if there's anyone who this dog may come in contact with who might respond harshly or with ridicule, then take that dog to another room. Don't yell at the person. That's only going to freak the dog out more. And, we don't really change other people, do we? But we can set a dog up to succeed. So, there are neurochemical and structural abnormalities in the dog's brain. There's heredity, and we've got genetic mapping now to understand the genome and how that is a factor. And of course, the herding breeds are overrepresented. And there's classical conditioning, like what I mentioned that happened on the irrigation ditch with that big, loud, very close clap of thunder that had I not jumped, my dog might have developed storm phobia later, but that very clearly kicked it into motion. Involuntary response on my part. So I tell people not just what not to do, but tell them this is what you should do. And that is be nearby. Your dog looks to you for security and for leadership, so just be there. And if the dog freaks out and starts racing around, do not restrain, because that jacks up the panic even more, and we've just got a worsening of the classical conditioning on these things. And of course, if the pet is restrained, they may behave in ways that they don't normally, like bite defensively, because they have to get loose. So what we're going to do is make it easy and have these pets have some choices, but give them opportunities to feel much better. So, comorbidities, common ones, separation anxiety, that's an almost daily problem. Fear behaviors like fireworks phobia is episodic, but they can coexist. So one tool that we have now, we're going to talk about pharmaceuticals here in a few minutes, but one of the best tools that come along in quite a while, relatively new product, it's a targeted pulse electromagnetic field device called the Calmer Canine. And you can see this picture in the lower right corner of this dog wearing it. It has this halo shaped thing that's part of it's producing the electromagnetic field, but behind the dog's head is the device itself. And I'll show you what that looks like in just a minute. But this is not a prescription item. The client can go to the CC website and order it. The particular website, they've got a website just to order it, and it's called calmercanine.com, C-A-L-M-E-R, the letter K, the number 9.com, and they can order one of these things. So here's a little story about a person who wrote in about this, and this dog in particular had a problem with storms, and she lives in an area where there are a lot of storms, and You know, you'll hear people say this all the time. I've tried everything, and there's nothing I can do that helped my dog feel better. So she started the dog with a calmer canine, and she found out very quickly that the dog would actually respond to her rolling a ball across the floor, and the dog would earn treats. And when they're super freaked out, they're not capable of doing anything normal. No, this dog actually, its anxiety was diminished enough by the pulse electromagnetic field device, the calmer canine, that she felt much better. So, you know, these things really work. And in fact, she sent a video. And here's this little dog, Sufi, just doing her thing, being a happy girl, you know, being the kind of pet people love to have in their life, right? But here's Sufi over here getting one of her calmer canine treatments. And you can see that she's perfectly comfortable with it. There's no sensation from it. There's no downside. There are no side effects. And it's a very easy thing for pet parents to use. Twice daily, 15-minute sessions. They don't have to hold the dog with them. Anyway, so the kinds of things that we want to do long-term is to teach the dog a different response. Don't freak out. Instead, do these things. And so we're going to, if we can, abandon the dog's old panic-related knee-jerk default, and we're going to give it something new that it can do. So we're going to make the dog comfortable. Again, set them up for success. And if people get, and sometimes it's trial and error, but some dogs have a real comfy bed that, boy, they just feel more secure in that. And so where can that be located? Well, dogs are denning creatures, don't forget, and they feel secure typically, not all of them, in a snug little enclosure with a low-hanging roof kind of thing. And an interior closet, doesn't have to be a walk-in closet, just a regular closet that does not have exterior walls. And they can crawl in there beneath the hanging clothing. And if it's got a carpeted floor, there's a lot of fabric there that will help to absorb sound. And they'll hang out in there, and you can put that special bed in there, and they can feel much better. Okay. Now, what I really love to do is give a dog something else to do, something to focus on, completely unrelated to what's going on. You know, the pet parent's right there, functioning as a secure, you know, just a rock for the dog to be near, but not necessarily interacting. We'll talk about how the pet parent can interact. But if the dog's had its meal withheld, and if we've succeeded in diminishing its anxiety significantly, and again, pharmaceuticals can be an important part of this, then the dog might actually feel good enough, if it's hungry, to work on a food dispensing toy, for example. Here's one of many kinds of these things. This particular one, and you know, the best ones for a dog are the ones that that dog likes. This particular one is called a twist and treat, and I like it because you can, you know, put canned or even dry food in this thing. You can screw it back together, leave a little bit, a big gap or a smaller gap. Sometimes people will put canned food in this thing and freeze it overnight in a Ziploc. And if the dog's accustomed to extracting food, then they have to really focus their brain and their mouth and their paws on manipulating this thing and figuring out how to get at the food, you know, a lot like foraging from some roadkill that a free-living feral dog. That's normal behavior, and it's a survival behavior. And again, if they're a little hungry, they might just really engage in this. And you know, you got the noisy fan or the white noise or through a dog's ear, a nice comfy place, and the dog is actually able to focus on a normal behavior. Well, it doesn't get much better than that because they can survive. You know, some dogs actually are trained to obedience commands. And so many people, again, this doesn't work for everybody, but many people will have treats in a treat bag, and the dog has, again, had its meal delayed, so it's just moderately hungry. And they put the dog through some of its paces, including little fun tricks and other games that the dog likes to play to earn food and say, gosh, I'm working for my leader. And don't forget, that's an interaction, but it is very different than comforting an anxious, freaked out dog. What we are doing is requiring the dog to work for its leader and earn resources. And that's what dogs are hardwired to do with their person. Yeah, they're our best friends, but they're not our equals. They are our subordinates. If we try to make them something they're not, that can create anxiety or add to anxiety. So if you treat them like a dog and say, this is what we can do, you can earn things from me and we can have a good time, and who cares about all that other nonsense? We're working on this thing. And now we've got a dog who actually can look forward to hearing those sounds and say to its leader, well, we've got a routine here, haven't we? And absolutely, and you're a good little pair, okay? There are relaxation exercises too. T-touch or Tellington touch. You can learn a lot about that. Just Google it. And there are these little moves you do on the dog's side that we don't know for sure, but they appear to have a neurologic basis for relaxing the dog. I like to encourage people to give the dog a chance to calm itself just a little bit, and then the dog earns the resource of being touched and having this relaxation exercise being done. In other words, the dog didn't just get it, the dog has to earn it. And the dog learns that, okay, I can even fake it. And dogs can do that. And they show a somewhat calmer body posture, and then their person goes ahead and engages in this. There, of course, is behavior modification, desensitization, counter conditioning. The CDs like Sounds Scary is one that has, thunder, fireworks noises, and you play that at a very low volume many times, and then a little bit louder many times, and so on. These things, frankly, are tedious and repetitive. I haven't found a lot of pet parents willing to do it. And those people who insist on doing that, I say, by all means, it may help, but do not believe that it is going to make the big difference. It is not going to hit the home run by itself. Okay, well, we're doctors, aren't we? We love to write prescriptions. We've got a whole lot of stuff here that we can use. Benzodiazepines are sometimes very helpful in these things because they can become effective in about 30 to 40 minutes after administration. Most of these are fairly short acting. I like clorazepate as or clonazepam, actually. I should change that. Clorazepate's perfectly good, longer acting benzo, but it can be a little expensive. Clonazepam is significantly cheaper, and in my hands, every bit as good. Benzodiazepines are so safe. You can look in Plums and you can get the dosage range, but you can bump it. They can do well. Now, there is a significant minority of dogs who get a benzo that have a paradoxical response. So you need to warn your clients. And the best thing to do is to try these things out before the thunderstorms or before the fireworks, because they're not necessarily good for everybody. But we like benzodiazepines in part because they are compatible with just about any other psychotropic medication. Trazodone, a serotonin agonist reuptake inhibitor, is very helpful on many of these. You can use it every 8 hours or every 12 if you like. The dosage is based on body surface area. That's why, we sort of look at it with milligrams per kilogram, 1 to 5 mg per kg. But if you go to Plums, you will see they've got a chart, and that's probably a little more accurate. We're sometimes using it above 5 milligrams per kilogram. It's very safe stuff. Some dogs get pretty groggy. They can have a drug hangover the next day. If you got 3 or 4 days of fireworks and the dog's taking his trazodone TID, that's not necessarily a bad thing. As you probably are aware, at higher doses, it has a sedative effect. Well, you just don't let the dog operate heavy machinery, and everything ought to be fine. You don't want to overdo this stuff, and so again, I like to suggest we do some trialing before the big events happen. SSRIs are, as anxiolytics, like fluoxetine, paroxetine, sertraline, they take a few weeks to become effective in most cases. But if you have other coexisting anxiety-related behaviors, like separation anxiety, again, commonly occurs with noise phobias, these dogs may be on an SSRI long-term, and then when we've got an as-needed event, such as fireworks or storms, you can add in the trazodone along with it, and they work very well together. Theoretically, there's a risk of serotonin syndrome. Frankly, we don't see it. Dexmedetomidine, we're all familiar with that stuff. You may also be familiar with Cilio. Cilio's been around now for 2 or 3 years. Wonderful product. This stuff comes in a syringe. It's an oral transmucosal gel, and the client slips the end of this. We usually invite them to put a little peanut butter, nothing with xylitol, thank you, between the lower lip and the gum. It's got a little locking wheel on the plunger of the syringe so that the client gives the right amount. There's a dosage chart that comes with it. And they inject this stuff between the lower lip and the gum, hold the dog's mouth closed for a couple minutes with their head up, Makes a huge difference. My border collie, Miss America, we have this stuff on hand. And one time recently, my family and I, we went up to Pagosa Springs for last 4th of July, rented a condo for the whole family. And they turned out to have fireworks literally right outside the condo. And my border collie, it was a problem. So of course I brought Cilio with me because it was 4th of July weekend. And one dose wasn't quite enough. After about, it becomes effective in about 20 minutes. And at 30 minutes, I wasn't happy enough with how she was doing. I just gave her another dose. This is a very low dexmedetomidine dose. It's an anxiolytic dose. It is not a sedative dose. So when I doubled it, I got better control, significantly better control of her anxiety, and she was a little sedated. We were fine with that. Pheromones like Adaptil, those things are helpful, but only as one small component of what you're doing. And of course, acepromazine, please don't do that. It has essentially no significant amount of anxiolytic properties. It is an antipsychotic, old-fashioned sedative. And people say, well, look, the dog's better. Yeah, the dog's, hardly able to move. And because its anxiety is still raging and the dog cannot manifest it and act it out, then that dog is in what we call a chemical straitjacket. We don't want that. Okay. Cats, lorazepam does not have intermediate metabolites like the other benzodiazepines. Lorazepam and oxazepam don't. Oxazepam is hard to dose because it comes in much bigger strengths. Lorazepam's easy to dose, and it's safe for cats. Gabapentin works great, and as most of us know, you can open a 100 milligram capsule, mix it with their food, and they eat it. And that's a very effective way to reduce anxiety as needed. And you can use Cilio, not labeled for cats, but you can use 1 dot on the syringe, apply it oral transmucosally, and they have done well, off-label. Don't forget to tell your clients it's off-label. So in the last few minutes here, expect relapses. These things, I don't care what you're using, this is going to be a problem again. And so people need to have a strategy for as needed events, but also if they're going to use the Calmer Canine device for this thing, that is going to take a treatment course of about 4 to 6 weeks in most cases before it makes a difference in separation anxiety, which we've got a decent proof of concept study. It's a pilot study that was done, and we've got another big one going on very soon, a double-blind placebo-controlled study on it. But it takes several weeks to start making a difference. The best use of that may be on some of these daily problems like separation anxiety, but dogs who have a storm phobia or a fireworks phobia also, we've got lots of anecdotal reports that indicate how well it works, like that little dog Sufi. So sometimes if the dog's already had a treatment course or more than one, and it's made a difference, and here comes July 4th, and people have a history with this dog, they can do a 2-week course restarting the Calmer Canine prior to July 4th. It is likely to make a difference. Okay, and in fact, some dogs, they feel better while they're using the Calmer Canine. So that's one of those things that the pet parent can do during the explosions. Okay, so we talked a little bit about desensitization and counter conditioning, and I'm ready for questions that I hope